Yes.
Okay, so shall we begin the session, sir?
Okay.
Okay. Good evening, everyone. Welcome to another interesting session with Team CAME. As we always say, an investment in education is always the best investment. So thank you for taking that journey with us. It's been 1 week that we have started the national webinar on Shirorogas. And today, it is my pleasure to welcome all of you to attend the session on the topic Kerala Traditional Chikitsa in Shiroroga. And this session will be conducted by our very favorite Dr. Sri Kumar Kesar, who is the Associate Professor at Government Ayurveda College Trivandrum in the Department of Shalakya Tantra. A few words about Dr. Sri Kumar sir. He completed his BAMS from Government Ayurveda College in Tripunithura and received the Dabur Ayurveda Award in 1998 and 2001 year for the first rank in second and third Prof BAMS examinations. Sir did his MS in Shalakya Tantra from IPGT and RA Gujarat Ayurveda University in Jamnagar and received the first rank and gold medal in MS Shalakya Tantra, Shiro Nasa Karna Evam Kandaroga. Sir completed PhD from Gujarat Ayurveda University in Jamnagar and received the Nagarjuna Research Foundation Award in the year 2000 and the National Ayurveda Scholar Award in 2011. So it is my deep pleasure. I welcome Sir to conduct this session and impart your knowledge and experience of 12 years and the experience of taking many international conferences and to share all that wisdom with us today. Thank you, sir. And please, I invite you to conduct the session.
Okay. So can I share the screen?
Yes, sir, sure.
So is the slides are visible?
Yes, sir.
Okay. So thank you, Dr. Namita, for the pleasing words. So today is the second session. In the last session, I have handled the Shilya Kapala Rogas and its Ayurvedic perspective. Today, the session mainly focusing on the Kerala Chikitsa tradition on the management of Shirorogas. I think in this CAME, you have already covered the Shiroroga, its diagnostic approach, how to approach the Shiroroga and the investigations regarding the Shiroroga. So after diagnosing the case, today in this session, we will discuss about how to approach the Shiroroga. How to approach means, as we all know, Nasahi Shirasodwaram. That means the Nasya is the one and only or the most effective treatment while managing the Shiroroga. But how to fix the procedures? A lot of procedures, including the Dhara, Shiro Biju, Shiro Vasti, Talam, Kshiradhara, like a lot of treatment procedures are mentioned in the management of the Shiro Roga and especially the Shira Kapala Rogas also. And the treatments are available and the procedures we know, but how to approach the case, that is very important. So while we are dealing the case of Shiro Roga, the perfect treatment, if we are fixing, then that will be very much result oriented and it will be very much helpful for the patient for the immediate cure, because as you all know that diseases like trigeminal neuralgia or the migraine are the very worrisome diseases and it is very difficult to cure completely as per in the modern science. So while the patient is approaching the Ayurveda, it is our responsibility to fix the minimum procedures to get maximum benefit of the patient. So the traditional approach is mainly oriented for the complete cure, means the um, classical approach that is mentioned already in the classics, but in Kerala, traditional approach that is specifically mentioned for the complete cure and to prevent the recurrences of the diseases. So the Shiroroga, that means it is a painful condition. So the Vata will be the leading dosha. But the Sthanika dosha is the Kapha dosha, and it is the Indriyas are located in the Shira. So we have to give the due consideration to Pitta also. So Sarva eva Shiroroga Sannipada Samudita. All the Shirorogas are in Sannipada in origin. So if it is in Sannipada, which dosha should be approached first? That is the fixation of the procedures. So Sannipada dosha means the disease, the patient is coming with pain, but we cannot approach the Vada directly in many of the cases. So we have to give consideration to the Kapha dosha, and then we have to move towards the Vata dosha. So the as you know the indications of the Nasya, Brahmanam Vadaje Shule Surya Varte Surakshayi. So the Surya Varta is a disease which should be managed with the Brahmana Nasya. But while we are doing or while we are analyzing the classical approach, so the Surya Varta should be managed just like that of Arthavedaka. The Arthavedaka treatment is it of Avapidanasya. So the Avapidanasya is not a Vada Shamana procedure, but the Suryavarta is indicated for the Brahmanasya. That means initially the condition should be managed with Tikshanasya so that the associated Kapha Shodhana should be done first. Then the complete remission of the disease will be taking after the Brahmanasya. So this concept is Acharya again focusing on or giving due importance while he is explaining the treatment. That means Tesham and Hidam Nasyan Sarpir Madhu Rasanidam, that we will discuss. So in the Suryavarta itself, the complete cure or the ultimate relief of the patient will be due to the Brahmanasya, but at the first stage, we cannot approach the Brahmanasya to the patient. For that, we have to start with the Avapidanasya and then switch over to the Brahmanasya. Like that, if the painful condition is there, but the approach is very much important while we are doing the Shiroroga treatment. So this is a case that means the relevance of Leshuna Rasayana in the management of ophthalmic neuralgia with respect to Vadaparya. This Vadaparya is actually it is a Sarvakshiroga, but the complaint of the patient is ophthalmic neuralgia. That means it is a variant of the trigeminal neuralgia, and the patient is coming with the unilateral pain. That means it is electric shock like pain. And in this approach, no doubt that the Vada is the main dosha here. Here, the patient that the treatment that we have done, this is a classical treatment that we have done in this case. And after that, the patient got very good relief, means the condition is not at all recurred after the 4 to 5 years also. So the patient, this was the treatment that we have given. So all these are just like the common line of approach. That means Deepana first done, then with Achasnehabana done, with Gugulu Tiktangridam, then Virejana done, then Nasyam, then Shirodhara, then Jaloka Vajaranam. Jaloka Vajaranam is, as we have discussed in the last class, in the all Shirakapala Rogas, it is important. And in Sarvakshirogas, considering the Sarvakshiroga, it is Jaloka Vacharana is also important. And then Yoga Vasti that we have done, Vicharana Snehavanam, then Pratimarsanasya Madi Syoda and Rasayana. That ultimate, the 14th treatment is the Leshuna Rasayana. So while we have opted the Leshuna Rasayana, because why during the treatment we have done the first day, when you see the observation on the first day of Tarpana, the patient got the conditions got aggravated. So the Tarpana means actually it is Sarvakshiroga, it is indicated for Tarpana, but the Tarpana, when we started the Tarpana after the Nasya, the pain got aggravated. In that condition, we understood that the Avarana Sabhava or the Sthanika dosha is not at all giving way to treat the case. So that we have stopped the Tarpana, and we considered that it is an avaranajanya vyadhi, and immediately we have started the Leshuna Rasayana. So the Leshuna Rasayana was the ultimate or the perfect treatment for that condition. And after the Leshuna Rasayana, the patient got complete relief. That means the pain come to the zero grade from the increased 6 or 7 grade to 0, and it is not at all recurred till date. So the Leshuna Rasayana is the treatment that is we have focused here, but the Leshuna, as we know, it is a single drug therapy for the Vata dosha, and if all the Avaranajanya except the Pitta Rekta Avaranajanya, Leshuna is very important. So in a condition, so the perfect that the Tarpana, while we have administered the Leshuna Rasana because of the aggravation of the condition with the Tarpana, actually if it is a clear-cut Vadika condition, the Tarpana should get, or the Tarpana should relieve the condition, but here the Tarpana aggravated. So that we have stopped that treatment, and the Leshuna Rasana that we have administered, it was the perfect treatment for that patient. So while we are handling the case, we need a lot of trial and error method, and ultimately we will find out the perfect treatment, and it will be the complete cure of the patient. And this is another case, that is Ayurvedic management of trigeminal neuralgia with respect to Anantavada. Here also the lock means here also we got a very good relief, but here while we have started the Shirodhara, the patient got very much aggravation of the pain. Because of that, as you have discussed, there is some triggering zones in Anandavada or trigeminal neuralgia, and the Shirodhara, the force from that stream aggravated the condition. In that condition, we have to stop the treatment. So we have converted that treatment to the Shiro Biju. So like that, if we are getting some pearls from the treatment approach, then we can modify our treatment, and one we will find out the complete cure with a perfect or single line of treatment. And this is another case means a 64-year-old male patient presented with blurring of vision for 3 months and occasional headache, and on fundoscopy the bilateral papilledema. So I think you may have discussed the condition. It is a pseudo tumor cerebri, that means increased intracranial hypertension. So the increased intracranial hypertension is causing the problems here, and it is confirmed by the fundus examination, that is the papilledema. So this was the treatment, the fundus of the patient. Just before the treatment, you can see the disc margin is very much blurred, splinter hemorrhages, and you can see the disc edema here. So this is a clear-cut papilledema, and the papilledema which is associated with the headache. So it is nothing but it is a Shiroroga, and it can be considered as a Shofa Samprapti. So here the Shofa Samprapti, that means we will not think about the Snigdha treatment or Brahmana treatment or the Thaila treatment. Instead, we have to focus on the Rukshana treatment, just like the Shiroleba or the Tikshna Nasya or the Lenghana treatment. So these are the main treatment. I'm not going to the details. So this was the main treatment that we have administered for that patient. That is the Punarnavadi Kashaya, Arthavillo Kashaya, Gomutra Arka. That means a lot, means I think a good quantity of the Gomutra Arka was administered for that patient. And the procedures, Kashayadhara, Takradhara, and Thalapodichin. These are the treatment that we have administered for that patient. No Sigda treatment or no Kridavana, nothing that we have administered. We have given the Rukshana line of management. So you can see this was the fundus just after the treatment. I think after 2 weeks itself, you can see the changes. That means the splinter hemorrhages is completely vanished, and you can now see the disc margin clearly. So previously, so this was the disc margin, that means blurred disc margin with the splinter hemorrhages, and projected when you see the blood vessels, the blood vessels in the center part of the disc is not visible, but in the peripheral part is visible. It is not visible in the central part because it is bulged towards the vitreous. That means the disc edema towards the vitreous, and here you can see the blood vessels in the disc. That means the edema is resolved, and the patient got relief from the headache. So I think here the Sthanika dosha with the Shofa Samprapti that we have considered, and no clear cut or no consideration of the Vada was given because the patient was presented with a very dull headache. And while we are seeing the other features, so it is having some Srodhorodha. So we have considered the Kapha dosha as a main line of uh, uh, pathology which is involved in the Samprapti. So we can say that this is the Shiroroga Chikitsa Tattva. That means Krimikshaya Krido Hitu. I am not going to the classical part. This is a reference from the Susruta. Here Acharya stress that Madhu Taila Samayuktehi Shiram Seti Virej. So the first line of management should be the Shiro Virejana Nasya. That means Madhu Taila Samayuktehi. So Madhu Taila Samayuktehi Shiram Seti Shiro Virejana Gana, that should be administered with the Madhu and Taila for the Shiro Shodhana purpose. And after that, Paschat Sarshapa Tailena Tado Nasyam Prayochit. So after that, the Sarshapa Tailena Nasya is advised. And after that, we have to give the Sarpinasya. So this is a line of management. If we don't know about the Samprapti Khadaga or the detailed Samprapti, this is a common line of approach, but not in Krimija Shirashula and Kshayaja Shirashula. That means if the patient is having a very severe debilitating diseases or very severe anemia like that, we cannot approach. In rest of all the Shiroroga, we can approach like this. That means a Shiro Shodhana, that is Shiro Virejana, followed by the Sarshabadala Nasya, then after the Shamana Nasya. Shamana Nasya means it is the Sarpitailam. That means the Vada Pitta Jayartham. So the first line is the Mula Nilo and Mulanatwad, that is the Sarshabadailam, and the Thyana Buddha Kafa Vinashanartham, Sarshabadailam, and after that, this is the Sarpinasya. So that the condition that we have discussed previously, the approach, our classical approach towards the Suryavarta. The Suryavarta means first Shiro Virejana Nasya, that is the Avapita Nasya or Prathamana Nasya or Kalkanasya. And after that, we have to end up, because the ultimate line of approach of Nasya is the Brahmana Nasya. So we have to end that treatment with the Shamana Nasya, that is the Brahmana Nasya. So this is the, as we have discussed, Nasahi Shirasaudaram and Urdu Jatur Vigaresu Vishesha Nasya Mishide. Means all the line of all the diseases should be managed with the Nasya, but the selection of the medicine is very important. So we can conclude that Nasya is a line of treatment, and especially in the Suryavarta and Arthavedaga, the Tesha Mande Hidam Nasyam Sarpir Madhurasanidam. This, as we ask in the general approach, Brumhyastu Mrudu Lankhe. This is the general approach in the Kaya Chikitsa. Just like that, we can approach the Shiroroga as Brumhyastu Mrudu Lankhe. That means most of the Shiroroga are Brahmana Nasya Sadhya, but before administrating that Brahmana Nasya, we can try for a Shodhana Nasya. So Tikshna Nasya or Shodhana Nasya followed by the Krida Nasya is the line of approach which can be administered in all type of Shiroroga except Kshayaja and Krimija. So these are the medicines of choice in Tikshna Nasya. These are the medicines that we are usually using in our OPD. That is the Surastha Swarasa and Shigri Bija and Shirisha Bija and Apamarga. The Shirisha Bija, Apamarga, Moolam, Nasyam, Vidanidam, Stirarasa. And these are the Arthavedaga, line of approach for the Arthavedaga. So here the Avapitaka Nasya is indicated because of the importance of Kapha dosha, and if the Sthanika dosha should be handled first, then we can go for the Swarsanasya or the Nimbasavanasya. The Nimbasavanasya is also indicated as a Srodho Rodhara, and it is very giving a very good Shodhana property. And after that, we have to move to the Brahmana Nasya, and the Shadbindu Taila, it is not a Brahmana Nasya, means as we have discussed, first the Madhu Taila Samayuktehi Shiram Seti Virejid. After that, Taila Nasya, that is Shadbindu we can approach, and after that the Varanadik Shira Krita. So that is ultimately the Brahmana Nasya or Kungumadi Taila that can be administered in a line patient of headache. The next traditional Kerala traditional treatment is the Tala. Tala means applying the medicine over the center of the head. I think most of the practitioners will be aware of the this treatment and a shorter and easier way of Shiroleba, and forms as a part of Kriya Krama. You see, it means the Kaya Segam, Pinda Svedam, Takradhara, Talapudachil, Nasim, all the treatments, Tala is an treatment, and this is the procedure of Tala. And the purpose of Tala, why we are selecting the Tala, or what is the condition where the Tala should be administered. The first is to know the Upashaya and Anupashaya. This is very important, to know the Upashaya and Anupashaya. Just in the previous case that we have discussed, the Tarpana aggravated the case. Then we have to stop. So that is not giving an Upashaya. Then we have to think in another way. Just like that, if we are planning to do a Tailadhara, then if we want to know is that patient or that condition is suitable to start the Tailadhara, so it is better to start with a Tala. So if the patient is getting good Upashaya with the Tala, then we can go for the Shirodhara or Shirobiju or Shirovasti. And so to know the Upashaya and Anupashaya, that means to know the underlying dosha, that means the kapha dosha, the aggravation of the kapha is reduced or not, means after giving the Tikshanasya. And if you are planning for a Shirodhara with the Taila, then just as a sake of Upashaya, then is the patient or is the condition is. Hello, am I audible?
Sir, we are facing some difficulties in between. The voice is breaking.
Actually, so when phone call is coming, right? So I think now it is okay now.
Yes, sir.
Okay, so that we have discussed, the first purpose of Talam is to know the Upashaya and Anupashaya. That means Upashaya means is the Kapha dosha or the Sthanika dosha is pacified, and is it suitable to start with the Shirodhara. And second purpose is to reduce the pain. That means as an emergency management, if the patient, if while we are doing the treatment, and as we know that migraine or is a condition where the patient will get aggravation of the symptoms due to triggering factors. So the triggering factors is the crucial for migraine, and triggering zones are very crucial for trigeminal neuralgia. So due to some dietary or due to some tension or changes in the sleep pattern, if the patient is getting some aggravation of the pain in migraine, then immediately there's a so, treatment to reduce the pain. The Talam is very important. And as an emergency management in vertigo, that means in some of the cases while we are handling like the Meniere's disease or the BPPV, like that, if there is a vertigo attack is coming during the line of management, then no need to stop the treatment, just advise the patient to start the Talam. So that Talam will give a good relief of that Prakupita Vada. So to know the Upashaya and Anupashaya during the treatment course, and to reduce the pain and reduce the vertigo, the Talam having a great role. So these are the common Talam that we are using in the traditional practice in Kerala Chikilsa, that is Tiruphaladi Tailam. In Netraroga, as we know, is Talam is applying over the scalp area, so it is useful for all the Indriyas and whole body. It will be going to influence. That means Urdhva Moolam Atha Shagam Rashaya Purusham Vidu. So it is a Moola. It is the Moola Sthana of the body. So the Talam which is applying over the head will go to the whole body. That means in the condition of sleeplessness, or in the condition of headache, or in the condition of the whole body edema, or in the condition of jara, all the conditions, the Talam is having a great role. So the Trifaladi Taila processed with the Masha Mudga and Kulatha, that is in severe headache, and Arugaladi Taila with the Trifaladi Kalkam, that is in Puyasravam, that is Manjishtadi, Balahadadi, and Asanaviladi in the case of Timiram, and Navanidam. It is mainly the Upasargika Linganasham, and these are the combinations with Navanida. Means Navanida, I think it is very famous in the conditions like Ardida. So the combinations of Navanidam, that is with the Padola Patra Sarasam, with the Eranda Tailam, that is Venatalam and Kshiram, then Villo Patra Kalkam and butter alone. So this Navanidam is having a great importance in the procedure of Talam. So if the patient is having a pitta aggravated condition, so the pitta aggravated condition means the patient is having a severe sleeplessness or burning sensation in the head, for example, in the piping or in the rectaja shirashula. In rectaja shirashula, the classical feature is the sparsha sahatum. So this is sparsha sahatum is allodynia. In that condition, the patient, if the patient is having very much sparsha sahatum, then we can start the Navanidam Talam. So this is the treatment that will given the result within immediate effect. So the combination with the Khradam, that is Shadadauda Khradam, and with the Swarasam, and the combination of the Kalkam like Amalaki Kalkam with the Takram, all that we are using for the Talam. So this is the procedure of Talam. I think no need to explain. So the patient sit comfortably and specific the site, the 1 unit distance from the tip of the nose using patient's own palm with extended thumb and index finger. Apply the medicine on the specified site with the 1 finger thickness and kept the medicine for the prescribed time. So usually for 45 up to 45 minutes that we are advising, and remove the medicine and wipe the area with cotton. Apply some churna, rasnadi or kachuradi, and time the morning and evening hours. So this is the Talam procedure. So the Talam is very easy to administer and it is very much effective in many of the diseases, that is many of the general diseases as well as the painful and vertigo, and as an emergency management it is very useful. So this is the Rasnadi Churnam, which is explained in the Sahasra Yoga, and this is the Kachuradi Churnam, which is also explained in the Sahasra Yoga, that usually we are practicing in the OPD, and this is the Shirastoda Guliga, which is also mentioned in the Sahasra Yoga. This Shirastoda Guliga is that will be crushed and made into a powder form, and to that we can add the Dhanandaram Thailam or Kshirabala Thailam or Madhyashtadi Thailam as per the convenience, and we can apply as the Talam. And this is the Marma Guliga. This is also used for the Talam as well as the Shiro Lebanam. And now I think now we have completed the application of Talam. So the application of Talam means as per the purpose of the patient as an emergency management and as a course of the treatment to identify the Upashya and Anupashya for Thailam or for Sneham that we can use for the, or we can go for the Talam. And next, if the patient is getting good relief or Upashya with the Talam, then we can move to the Murtha Chigilsa. That means Abhyanga Sega Pijo Vastis Chedi Chaturvida Murtha Thailam. So we can start the Murtha Thailam. So in which the Murtha Thailam means the most of the condition, the Shirodhara is we are usually practicing in the clinics in many of the painful Shirorogas. That means other than the painful Shirorogas, the scalp diseases, that means the Dharanagam and the Arungshika, all these having very good role in the Shirodhara. So the eruptions of the scalp, headache, burning sensation, suppuration, ulcers, and neurological conditions. As you all know, the patient is having some Pakshaghata or Ardhita or Ekangavada. In that all conditions, the Shirodhara we are usually practicing. So in the Shirodhara and the Shirasegam. So these are, I think, Shirodhara. Or Shirasegam, both are the same. We have to select the medicine. That is the okay. Hello.
Hello, sir.
Am I audible now?
Sir, ഇടയ്ക്ക് കുറച്ച് മൈക്ക് ഡിസ്റ്റർബൻസസ്
അത് കോള് മൊബൈലിൽ നിന്ന് കണക്ട് ആവുന്നോണ്ടേ കോള് വരുന്നതാണ്. ഇപ്പൊ now I think
ഹെഡ്സെറ്റ് ആണെങ്കിൽ കുറച്ച് ഡിസ്റ്റൻസ് ഒക്കെ സർ, ഇടയ്ക്ക് ഒരു ഡിസ്റ്റർബൻസ് വരുന്നു.
Okay. I think now it is okay.
Yes, sir.
Okay. So the Shirodhara and Shirasega, both are the same. And if we are getting Upashaya with Talam, that means the patient is or the condition is very much suitable to apply or to receive the Sneha, then we can start the Tailadhara or Kshiradhara. Both that we can do. For the if the is Pitta Vada, then we can go for a Kshiradhara. And if it is that Vada Adhika Vada Pitta, in that condition, we can go for the Tailadhara. That's both this Tailadhara and Kshiradhara that we are uh, frequently practicing. So this is the procedure of the Shirodhara. That means that we can as a single indication, we can say that if it is Vata predominant, go for the Tailadhara, Vata Kapha predominant, go for the Takradhara, and Vata Pitta predominant, then go for the Kshiradhara. So in the Tailadhara, the main drugs that we are using is the Kshirabala, Shuddhabala, Madhyashthyadi, Dhanandaran Taila, and Mahanarayana Taila. That is we are frequently practicing. And in Kshiradhara, so if it is the patient is having a Pittadhika, that means Pittadhika means the condition, means in the Arthavabedaka, actually it is mentioned that Vada Kafaja by Acharya Charaka, whereas Vada Pittaja by Acharya Dalhana. Actually, as we know, the migraine is usually occurring in young age, and it is maximum tension related, or it may having some triggering factors like sleep disturbance or some stressful life. In that condition, we can see it is the Pitta predominant condition. So if it is having a Pitta predominant condition and the patient is having very much insomnia with the stress, and the patient is having some burning sensation, then it is better to start with the Kshiradhara. So the Kshiradhara, that means the mainly, that means any of the medicine that can be converted into the form of Kshiradhara. That means Dashamura Kshiradhara or Guluchadi Kshiradhara or the Drakshadi Kshiradhara, like that, as per the convenience that we can convert the Kashaya to the Kshira. So for that, the Kashaya Churna should be taken as 100 gram, then add 4 liter of water and reduce to 2 liter, and then add 2 liter Kshira and reduce to the Kshira Paga, that means to the 2 liters, and which can be used for the Kshiradhara. So that in the line of management, when we thinking about the Shirodhara, if the patient getting good Upashaya with the Talam, then we are moving to the Tailadhara or Kshiradhara. And if the patient is not getting Upashaya with the Talam, then it is better to start the Takradhara or Dhanyamladhara or Kashayadhara. That means the patient is not in a position to accept the Sneha. Instead, we have to do further Rukshana. So further Rukshana means Srodho, Shodhaka treatment and the Kafashamana treatment is required. So the Takradhara and the Dhanyamladhara and the Kashayadhara can be adopted in the condition, the just that we have discussed in the intracranial hypertension. In that condition, the Takradhara or Dhanyamladhara is very effective. Or in conditions like a diabetes related problems, that is, for example, in diabetic retinopathy, in that condition, the patient is having Kapha Pradhana Pittam or Kapha Pradhana Tridosha. In that condition, don't jump to the Brahmana line of management. It is essential to start with the Shrodha Shodhaka and Kafashamana local therapy, that is the Takradhara, Dhanyamladhara or Kashayadhara. So in the Kashayadhara is that is Dashamula Kashayam or Guluchadi Kashayam that can be used, and this is the famous Takradhara. I think everyone will be very much aware of the combination, that is Amalagi, and boil 8 liter water and reduce to 2 liter, then separate half liter from to wash head after the procedure. For Takkar preparation, take Musta 100 gram, milk 1.5 liter, Dadi 1 glass, and add 4 times of water to the 1.5 milk, and put Musta potally to it and reduce to 1.5 liter, and add Dadi after cooling and remain for 12 hours, and add half liter Amalagi Kashaya to it and churn to remove the Navanida and collect Takra. and mix the kashaya 1 liter and takra 2 liter for the procedure. So this is the classical method of preparation of the takra for the takradhara. So takradhara is a widely practicing treatment in Kerala Chikilsa, mainly if we are observing that kapha is having some importance in the pathology, then it is better to start with the takradhara. So this is the dhanya navadhanya kiri. So it is means we are preparing the pottery with navadhanya navadhanya kiri. So this navadhanya kiri is also very important. So in the condition, so it is mainly for the rejuvenation of the condition. That means in the kshayaja shirashula, or if it is a cerebral atrophy condition, or if the patient need more brahmana other than the taila or other than the kshira, then we can opt for the navadhanya kiri. So navadhanya kiri is also very good in the management of the neuralgic conditions. That means in the end stage of trigeminal neuralgia or post-herpetic neuralgia or the glossopharyngeal neuralgia. In that neuralgic pain, it is very effective. And in the general conditions, if the patient is having some cerebral atrophy or the Parkinsonism, if the patient is having those problems also, then the navadhanya kiri is very good. And next condition that we can opt for the Srodho Shodhaka purpose is the Mukhaleba. That means Mukhaleba is also indicated in the Shiroroga. And the Triphala, Gairika, Chandana, Haridra, Daryuha. This is the common drugs that we are used in the management or in the procedure of the Mukhaleba. So this is the Mukhaleba. Leba means it is always indicated in the kapha pitta pradhana condition, and mukhaleba is mainly the rakta pitta condition like diabetic retinopathy or raktaja rakta pradhana samprapti is occurring, then mukhaleba is very effective. And this is the annalebanam. Annalebanam means it is a minor form of the navadhanya kiri. So it is as a sthanika chikitsa for the Vata Kopa in muscle weakness and nerve weakness as rejuvenation. As we have discussed in the Navadhanya Kiri, it is a minor form of the Navadhanya Kiri, that Annalebanam. That means the Nyavara is prepared and that Nyavara Lebanam is conducted over the scalp area. So that is termed as the Annalebanam. So in some conditions, we are doing the Annalebanam around the eyes. If the patient is having some blepharospasm or ptosis, then that condition, the annalebanam is very effective. Or the patient is having just that we have discussed the neuralgic pain or muscle weakness or cerebral atrophy. In that condition, the annalebanam is very effective. And it is in the Cristron Mila, Vadahada, twitching of eyelid, dry eye, Cristron, this Vadahada. In all that condition, this is very important because these all conditions are related to the neurological origin. So it is very important. And Shastika Kukudin Balamula Siddha Kshiram, and we have to advise that in this procedure, that is the annalebanam. And the Shirolebanam. Shirolebanam is mainly, we have discussed the Shirolebanam. Lebanam means it is used in the Pitta Kapha Pradhana Vyadhi. That means if Pitta and Kapha having a common feature, that is both having a chance of getting Ama or Srodha. In that condition, it is better to start with the Shiroleba. That is Eshtimadhu, Rektachantanam, Daru Haridra, Guluji, Triphala, and Gairika, and make Kashaya and mix powder and make the paste and used for the Shiroleba. So this is the procedure of the Shiroleba. So the Shiroleba is very effective in the diabetic retinopathy also. Once the as a site of administration or site of application of the medicine, this Shiroleba is used for the Samprapti Vikhatana, which is happening in the Urdhva Jatrugata. That means in the any of the Shalakya disease. If it is in the Urdhva Jatrugata Samprapti, we can go for the Shirolebanam. Means if the patient is having an Abhishanta Samprapti. Abhishanta Samprapti means it will be happening in the eyes as well as it will be happening in the nose also. Means Sarva Urdhva Jatrugata Srodasam Syandana. Urdhva Jatrugata Srodas having an Abhishanta, then it is the line of approach to start with. That is the Shirolebanam. Don't think about the Shirodhara or any type of Brahmana treatment if the patient is having an Abhishanta Samprapti. This is the Talapodichil. In the case of kapha, the Talapodichil means it is the Shirolebana, and in the mainly used in the cases of kapha, pitta, vriddhi, and to treat the increased shofa. So if we are suspecting a shofa samprapti means it is a samprapti of abhishanta, means that's rasa vaha srodo rodha, or the shofa samprapti that we are suspecting, then it is better to start with the Talapodichil. So we can approach the Shiraseka or the Murtha Daila like that, means Upashaya with Shirodhara. Then Upashaya with the Shirodhara means if the patient is giving more potent treatment than the Shirovasti. So the Shirovasti is Abhyankasika Pichova Vasti Shedi Chaturvidam Murtha Dailam. So the Shirovasti is the ultimate treatment to get maximum benefit of the Murtha Daila. So if the patient is having good Upashaya with the Talam, then go for the Shirodhara. And if the patient is improving, then we can opt for the Shirovasti. So the Shirovasti indications means it is the paresthesia of the scalp, facial palsy, loss of sleep, dryness of nose and mouth, defective vision, and dreadful diseases of the head. In any of the Shiroroga, we can adopt the Shirovasti. But the conditions like trigeminal neuralgia that we have already discussed, the patient is having some triggering zones, triggering factors for the migraine and triggering zones for the trigeminal neuralgia. So if the patient is having some irritation for the frontal nerve, that is my frontal nerve, it is a branch of the ophthalmic division of the trigeminal, and if that is the point where the patient is having some triggering zones, then if you are trying to do the Shirovasti, then the patient may aggravate the pain. So it is essential to understand the condition of the patient before starting the procedures. But if the patient is in a condition to accommodate the Shirovasti, then it is the best treatment among the Murtha Daila. This is the procedure of the Shirovasti, so mainly used in the Vada Shamana treatment. So if any other dosha is accompanied, that means Pitta is accompanying, then we can do the Shirovasti. And if the Kapha is there, then it is not at all suitable. So we are doing the Shirovasti only with Taila. No other treatments or no other Drava is used for the Shirovasti. That means the Shirovasti is especially we are addressing the Vata dosha. The main medicines that we are used is the Mahamasha Tailam, Narayana Tailam, and Kshirabala Tailam. So all these three medicines which is frequently using in that condition, because here we are oriented to get a Vada Shamana procedure. So the Mahamasha is very effective, and this Kshirabala is also very effective for the Indriya Prasada also. And the Shiropiju means it is having a specific indication other than the Shirodhara and the Shirovasti. That means if the patient is not in a position to accommodate the Shirodhara and the Shirovasti, then we can go for the Piju. And if the Piju having a specific indication, that means in the alopecia and in the cracking of hairs or scalp skin dryness, immobility of eyes, scalding of scalp, that means mainly in the previous class we have discussed, if the patient is having some samprapti which is happening on the root of the hairs, that means kajashadana siddhatum pincharatum, that it is the murtha, that is the indications of murtha thaila is going, and the kesha shada sphutana dhubani Netrasthambe. That means in that condition, Shiropiju is indicated. That's Kesha Shadam. That means the falling of hairs. In that condition, we have to give the Shiropiju with the prescribed Taila. So the specific procedure of Shiropiju is mainly indicated in the scalp hair problems. So this is the Shiropiju that we can again say that it is the Vadacha conditions we are using this procedure, and only Taila is used for the procedure, just like that of Shirovasti. So I think no need for the discuss of the probable mode of action, as we have discussed in the last class. A scalp is having a 20 nerves and a lot of arteries. So this severe that is circulation or the rich blood supply from the internal carotid and external carotid with the means that means numerous anastomosis. That means if there is a cut in the scalp occurs, then that artery will start bleeding from the two ends. That means a rich blood supply and a rich nerve supply, that the lot of absorption will happening in that area. So the Shiro Abhyanga, this Shiro Abhyanga is usually that we are uh, giving as a follow-up treatment or as a daily routine practice or as a dinacharya, we are advising this Abhyanga. That means mainly the dryness of scalp, itching of the scalp, accumulation of the debris in the scalp. That means Tatra Abhyanga Prayoktavya Raukshya Kandumaladishu Arushiga Shirastoda. Means in the Shirastoda means the Shirashula also, we can give the Abhyanga as a follow-up medicines, or if the Samprapti occurs in the scalp, especially the hair fall or dandruff, in that condition as a daily routine practice, we can advise the Shiro Abhyanga. The Shiro Abhyanga should be advised in the daily use, and it is a preventive aspect, and the Thailas are usually used. That in the last class we have discussed a lot of medicines that we are using in the scalp diseases for the Shiro Abhyanga, and it is a common practice in Kerala. That means that is the Shiro Abhyanga. That means the Shiro Abhyanga is very effective in the migraine. That means this it is proven that the scalp massage will relieve the migraine pain. So in that condition, we are getting an immediate result by doing the Shiro Abhyanga. And this is the Rekta Mokshana. Rekta Mokshana means it is mentioned as a part of general management of the Shiro Roga. That means we have discussed in the last class, if the patient is having scalp diseases, as the scalp is the skin means it is the essence of Rasa and Rekta. The scalp diseases having a great role in means Pitta and Rekta having a great role in the diseases manifesting in the scalp. So in that condition, the Rekta Mokshana is very important. And in Shirashula also, the Rektaja Shirashula, Suryavarta and Anandavada, the Rekta Mokshana is indicated. Yeah, Acharya Susruta clearly mentioned that Anandavade Kartavya, Suryavarta Harovidhi, Sira Vedasya Kartavya, Anandavada Prashantaye. That means in the Anandavada, it is that we have discussed, it is the condition having a trigeminal neuralgia. That's mainly the trigeminal neuralgia is caused by the pressure effect of the artery. So the pressure effect of the artery can be relieved by a perfectly performed Rekta Moksha. So that is very much relieving. That means it will immediately relieve the pain in diseases like trigeminal neuralgia, and for the complete remission of the diseases manifesting in the scalp, the Rekta Mokshana is very important. And this is a condition that we have managed in our OPD. The Indralupta, that means the falling of scalp hair in a round pattern. So you can see these are the various stages in which in the first picture you can see after the prachana, the hair starts appearing, and the last picture is the follow-up, means in the late stage of the treatment with the 2 or 3 sittings. I think 3 sittings that we have done with the prachana. So the patient got very good relief and the complete condition completely relieved. So in the Rekta Mokshana means we can adopt the prachana or kuttana or siraveda. So in the siraveda, that mainly we are using in the painful diseases like Anantavada, and in the scalp diseases we can go for the prachana or kuttana. Kuttana means the treatment which is advised in the pakshmashada. Pakshmashada means pakshmashada kuttayedu pakshmashadana. That means the falling of eyelashes. So the falling of eyelashes and the falling of the scalp hairs, as per the Ayurvedic concept, falling of the hair means it is a vata pitra samprapti is there, and there will be associated with the recta. So that in the romagopanugam pittam vadena saha morchidam prachavendi romani tada slashma sashonidai, like the samprapti which is applicable for the hair loss of hairs which is so we can see this is the two pictures, that is the before treatment and after treatment. The patient got very good relief. So I think no need of any detailed treatment here. If the patient is presented with this type of problem, we can see the patient is having very good thick hairs, but due to some problems in that area, the scalp hair is lost. So immediately start without any delay, not giving without going for any type of nasya or snehabana, nothing, no need of that like treatment. Immediately we can go for the kuttana or prachana, so that will go to respond very fast. So this is a case where you can see that this is an alopecia. It is an alopecia universalis. It's a case like that. You can see the eyelashes is also very much less in quantity, and the eyebrows are very less. This is, I think, it is a picture in between the treatment. And this is a treatment, this case that we have not got any relief. This was a case of alopecia universalis, which was manifesting in a child. That means the child lost all the hairs due to some drug reaction. That child lost all the hairs, including the eyebrows and all the scalp hairs. But after the treatment, we got a few hairs are coming, but the condition was not responded very well. So this is the Siravedham. So this type of Siravedham is specifically indicated in the neuralgic pain. That means in the trigeminal neuralgia, if the patient that we have discussed, the trigeminal neuralgia, the patient is having severe problem, and if the patient is advised for the surgery, so that is the surgery that they are going to practice is the decompression surgery. That is middle meningeal artery is the artery which is going to compress the trigeminal ganglion, that is a Gazarian ganglion. So to make the decompression by of the artery to the Gazarian ganglion, they are planning for the decompression surgery. And in some cases, after the decompression surgery, also the patient not getting good relief. So if the patient is very much improving with our Ayurvedic treatment, and the recurrences is the main problem, means once the pain is reduced, then there is a high chance of recurrence is there. So in that condition, the treatment is of choice is the Siravedha. So the Siravedha, I think the immediate relief, actually, Acharya Susruta mentioned that is Siravedasya Kartavyo Anantavada Prashantaye. That means that for the immediate, Anantavada means as per the pathophysiology, we can remember that the severe Gandasya Parshetu Karodi Kampam Hanugraham Lojanajamsha Roga, like that, a lot of problem and unbearable pain and electric shock like pain. If the patient is having not at all cope up with that severity of the pain, then we can immediately go for the Siraveda for the relief. And this Dhumapana. Dhumapana is also very important, as we have discussed. Jatrurtha Kafavadota Vigaranam Ajanmane Utsedayacha Jadanam Pibe Dhumam Sadatpame. That means for the preventive aspect, also Dhumapana is very effective. That means if we got a good relief with the treatment, and if the patient is going to for the same Nidana Sevana, then the Dhumapana can be advised as a daily practice to reduce the accumulation of, or to reduce the samprapti. That means the Varti prepared in sterile cotton, that Haridra Gukulu with the Khrida, Varti burned in fire and smoke is inhaled, and 3 puffs through each nostril alternately should be advised. So it is mainly indicated after Vamana and after the Nasaroga. That means a kapha, Vata kapha samprapti that we are um, suspecting, then we can go for the Dhumapana. So this is a procedure of the Dhumapana. And I think I have mentioned most of the treatment that we are practicing in our OPD that we have discussed today. So I would like to convey that this is the main part, or this is the conclusion of the slide. That means while we are approaching the patient having headache, talam is the main part in the Kerala traditional practice. That means talam has a lot of applications starting from the headache to the paralysis of the body. So relieve the headache, improve the sleep, reduce the tension, a lot of procedures. That means mainly the thalam is indicated, and we can advise a lot of medicines like Navanidam, Kridam, Thailam, Keram, like that, a lot of medicines that we can use. That means the Marmagulika with Kshiravela or Dhanandaram or Brihad Vada Resam, that for mainly for the internal use, but for the talam, that means in the one famous yoga which is mentioned by the Sujika Bharanarasa, which is mentioned by the Acharya Sharngadhara. For while we are discussing that area, while that area is selected for the application of the Sujika Bharanarasam, it is mainly due to the rich circulation. That means if the medicine is applied over the scalp area, then it will be easily absorbed. That means it is the management of the Sarpavisha or Murtini Kakapatam Krutva. That means the seventh vega of the Sarpadamshta. That means it need an emergency management. So the route of administration of an emergency management, or we can otherwise say that it is a parenteral route of administration. That means all the medicines in Ayurveda are administered in the enteral route. But while we are discussing a parenteral route of administration, that means the if we want to give the medicine directly to the vascular system, then the scalp is the area of choice. So the scalp is having a rich blood supply, rich nerve supply, and the medicines applied in that area is going to be absorbed very effectively. So the thalam is also having a very good medicine. And the Shiroleba. The Shiroleba means in the flow chart you can see that means if you are starting with the talam, and if you are getting the anupashaya, that means the patient is not in a condition to accommodate the sneha, then it is better to start with the shiroleba or takradhara or kashayadhara. And if you are getting a good upashaya, then go for the murtha daila means as per the convenience of the patient, abhyanga, seka, pichu, and vasti. But Shirodhara and Shirovasti that we are usually doing in the IPD practice, and for the hair related problems that we are advising the Shiro Pichu, and as a follow-up treatment we are advising the Shirobhinga. And the Nasya is the line of management of all the Shiro Roga, and the principle of application of the Nasya that we have already discussed. The line means we have to start with the Shodhana Nasya, and which should be end up with the Brahmanasya for the ultimate cure of the condition. And in the Rektamokshana is the line of approach of painful head diseases. That means it is having a neuralgic severe pain. If it is the Rektamokshana, ultimate indication of Rektamokshana means if the condition is not improving with Snigdha, Ruksha, then Ushna and Shida, then we have to go for the Rektamokshana. Like that, if the patient is having not responding with the classical line of management, or if the patient is having an unbearable pain, in that condition, Rektamokshana is the line of management. And in the diseases which is manifesting in the scalp and having a high recurrence, then it is also very beneficial to go for the Rektamokshana. So this is the all about the presentation. So I would like to show one video of the Kuttana procedures procedure that we are practicing in the OPD. So this is a procedure of Kuttana. Kuttana means that we have already discussed is the minor form of the Prachana, and Kuttana means it is the specific treatment mentioned in the Pakshmashada. Pakshmashada that we can consider is the Samprapti of all the hair falling of hairs. So falling of the hairs means the patient is not improving with the treatment. Then the first line of approach which should be given without considering the other dosha. That means not no need to go for a Snehapana, Virejana or Nasya. Instead, we can directly go to the Kuttana, and after that we are usually applying a Tikshna Leba, that means Durdura Patrasarasa, or in some cases Interluptamashi will be applied. So I think in most of the conditions that we are usually practicing is discussed. So thank you for the team for giving me a chance to discuss the treatment and the line of approach in the Shiroroga. So, thank you.
Thank you so much, sir. So the class is very intrigued about the rest of the session. The questions have already started coming up in the chat box. So let us move on to that without any delay. So the first question is from Dr. Pallavi. Sir, can we use Talam in peripheral neuropathy?
As we have discussed, the Talam means it is having a wide range of application. So means in while Acharya starting the Shiroroga mentioned that Urdhva Mula Madhashagam Prisheha Purusham Vitu Mula Praharinas Tasmin Rogan Shikradaram Ched. That means the disease which is manifesting in the head is definitely going to affect the whole body, or the it is one of the Trimarma. So Hridaya Murthini Vastocha Nranam Prana Pradishtitaha. So it is having a Prana Sthana or Sharira Mula Sthana. So it is no doubt that we can give Talam in a condition of peripheral neuropathy.
Thank you, sir. The next question is from Dr. Rituja. So what treatment would be best in the condition of twitching of eye and dryness of eyes?
Itching and dryness.
Twitching.
Okay. Twitching of eyes. So that we have discussed when a patient is coming with the twitching of eyes, means twitching of eyes can happen in many of the conditions. We have to rule out the eye strain, that we had to rule means think about the visual acuity and age of the patient. Is it a presbyopic or not, like that, and the use of computers and the corneal irritation. That means the cornea, if the cornea is going to dry, then the patient may start twitching of eyes. So if there is no other pathology is going on, and for approach the twitching means that we have already discussed, it is a we can consider it as a neurological origin. So if the patient is having a long standing twitching, then the best treatment is the Annalepanam. So Annalepanam means just the Nyavara. That the Annalepanam is the best treatment. So before going the Annalepanam, it is better to start with the Sneha Sweda. So the Sneha Sweda means the local application of Kshiravalla 7 avarti, the 7 avarti that can be applied around the eyelids and give lukewarm fomentation. So that is the twitching of eye, means it is most probably it will be the Kevalavadika. So the line of management of the Kevalavada is the Snigdha Sweda. Means the Snigdha Sweda, after the Snigdha Sweda, then we can do the application of Nyavara or Annalapana. Annalapana is the procedure which can be used in all type of neurological conditions. So the twitching of the eyelids, in other words, if it is the patient is coming as a trigeminal neuralgia, it is also a twitching. Acharya Susruta mentioned that Gandasya Parshyatu Karoti Kambam. It is also a twitching. So if that twitching is spread to the maxillary division, then the Gandasya Parsha means the cheek will start twitching. So in that condition also, except other treatments, means after completion of that the other treatment, or as a support of the main treatment, we can start the annalepanam. But this annalepanam in a condition of the trigeminal neuralgia, it should be done in a very gentle manner, otherwise it will go or it will start aggravating. So in the annalepanam we are using the medicine as well as a local massage. That is the local massage along with the annalepanam and application of the Sneha Svedam will definitely relieve the condition like twitching of eyes.
Thank you, sir. I hope the answer is clear. Now, the next question is from Dr. Anju. Sir, please explain about the selection of Sira for Sira Veda in Shiro Rogas.
Actually, in Shiro Netra Vikareshu Apange Mokshel Siram, that is or Lelada. Mainly the Lelada is the site of Siraveda. So in the Siraveda, that means I think you may be aware about the procedure. In the Siraveda, we have to apply some pressure on the neck. So in that condition, the eyes will start prominent. So Lalada Sira means it is mainly the superficial temporal artery. So that maybe get engorged or it will be projected. So that area is the site of puncture. That means mainly the Lalada Sira is the option to go for the Siraveda. Means if we are not getting that area, means as per the anatomy, that will be prominent in that condition, because the arterial circulation in that the Lalada Sira will be prominent when we are applying the pressure over the neck area. So that is the site of Siraveda.
Thank you, sir. The next question is from Dr. Sanoba. So what is the line of treatment for dandruff, scaly scalp?
Hello?
Hello, sir. Can you hear me?
Yes. What was the question?
The line
Dandruff?
of treatment for dandruff, scaly scalp.
Scaly scalp. Actually, in dandruff and scaly scalp that we have discussed in the last class, Susukshma Kafavadabhya Vidyadharanagam to that. Kafavada is the dosha. So the Kafavada dosha is there, then it is better to address the Kapha dosha first. So the first approach should be of Rukshana type. Rukshana type means the Takradhara. If the patient is having a severe dandruff or long-standing dandruff, then it is a Takradhara is the main, means Kafavada Shamana. Takram is the perfect Vata Kafa Shamana drug. So if we are starting the Takradhara, it is the best. So if the patient is not able to go for a Takradhara, then prepare the Takram and tell the patients to wash the hairs or wash the scalp. It is okay. Then we can go for removal of the scales. So after the scales are get separated and removed, for that we have to need the takra or for the kashaya. Or in usually we are advising the patients to wash the scalp with the amalaka kashaya, or if we can advise the takra, it will be best. So after the scales of the dandruff are completely removed, then it is better to prevent the recurrence of the scaling. So to prevent the recurrence of the scaling means we need an Abhyanga, Shiro Abhyanga with the Taila. So first line is the Rukshana followed by the Shiro Abhyanga with the Taila. Shiro Abhyanga with the Taila means the Malatyadi Taila. It is clearly mentioned in our classics. Or the Chambaratyadi Taila or Kera, or the Durdura Patradi Kera means if it is coconut oil based, Thaila means it is an oil based. So whatever the treatment, whatever the medicines, the first line should be the Rukshana followed by the Snehana, that is the application of the oil in massage, that is should be in a daily practice. So if the patient will start after the means Rukshana, if the scales are removed, and when the patient will start again developing the scales, when we are starting the Styla Abhyanga, then it is better to advise the patient to do the uh, hair wash or to do the scalp cleaning with takra or with kashaya uh, alternate days or twice in a week to prevent the recurrence. So again, the patient is having the problem, then it is better to go for the Vamana. Vamana means we have to go for the Snehavana with Araguda Mahatiktaka or Tiktaka or Padoladi Krita and go for the Vamana. That means in the classics also it is mentioned that Ashanto Shirasaha Shuddhi Yadeda Vamanadhibihi. So if it is not at all responding with the Shamana treatment, then it is better to stop all the Shamana and then go for the Snehavana and the Vamana, then followed by the Nasya, and then again start the local line of management.
Thank you so much, sir. The next question is from Dr. Ritija. Sir, which Nasya is best in the case of promoting hair growth and preventing hair graying?
Actually, for promoting hair growth in Ayurveda, it is mentioned that is Kungumadi is very good. And in Taila properties, Akshadailam, that means Taniyanna, that is Akshadailam is also very good for Pratimarshanasya. And as we know, if we are for the hair promotion, we need a Brahmana treatment or Vata Pitta Shamana treatment we need. But if there we are using this medicine for a long time, then there will be a Sthanika Kapha dosha will be there, Kapha dosha aggravation. So it is better to do the Anudayala Nasya. Anudayala Nasya means it is indicated for the daily purpose. So it is better to do the Anudayala Nasya in 15 days, and in between it is better to go for the Brahmana Nasya. And as per my experience, this need a minimum of 3 months treatment for the relief of the condition. So whatever may be the medicine that we are applying, the concept is the Vada Pitta Shamana should be there. So Vada Pitta Shamana means it should be the Brahmana Nasya. And in Shamana Nasya also indicated in Ashtanga Hridaya, Shamanam Niliga Venga Kesha Dosha Akshirajishu. Means Kesha Dosha Shamana Nasya is also indicated. So first, if we are we have to give the importance of Sthanika Kapha dosha. So first go for somewhat Rukshanasya and then again switch over to the Brahmana Nasya, and meanwhile we have to advise the Anudayala Nasya. Like that, we have to follow the condition for minimum of 3 months.
Thank you, sir. Next question is from Dr. Rekha. Sir, for Kuttana, what type of lancet should be used?
Kuttana, I think we usually, that means that video that I have shown is the insulin syringe. It is enough. That means our aim is to stimulate the hair follicles. So for that, to promote the hair growth, the insulin syringe is sufficient. But if we are doing with the insulin syringe, then we can give a numerous pricks. And if you are doing with a lancet, then it is going to create a wound, and that means it will start a profuse bleeding, and we cannot do the stimulation of all the hair follicles. So Kuttana, if you are planning for a local hair loss, then it is better to start with the insulin syringe is the best. And all other syringes will start bleeding more, and we cannot cover the whole area. But in an insulin syringe, we can numerous pricks can be given, and it will not be bleed, it will not going to bleed heavily.
Thank you so much, sir. Now there's one more question. Sir, for sleeplessness, which tala can be given?
As we have discussed, for the sleeplessness, Navanida Thayalam is very good. Navanidam. That means Venna. Venna is the very best medicine. And if it is not available, then it is better. Usually we are giving the talam with the Ksheeravala. Ksheeravala is also a very good condition which is mentioned in the Vada Rekta Chikilsa, and it is also Pitta Rekta Shamanam. So we can go for the Ksheeravala also. But if the patient is having an old age with a severe sleeplessness, then it is Navanida Talam is the best one.
Thank you, sir. The next question is from Dr. Taj. Sir, can we use Tikshna Mukhaleba in case of frontal, maxillary, and ethmoid sinusitis?
I think Mukhaleba, Tikshna Mukhaleba means in Kafaja Shiroroga, I think Gaura Sarshaba Lebana is mentioned. Shirasa Gaura Sarshaba Lebanam. So that application of the Tikshna medicines are mentioned in the scalp area. So if you are applying that much as Tikshna medicines over the face or in the mukha as a mukhaleba, then it will start irritating the skin. That means the face skin is very much delicate and having a very good blood supply also, and a very soft skin. So if that soft skin means wherever the skin is there, then the underlying dosha is the pitta rekta along with the kapha rasadhatu. So if we are going for a tikshna leba all over the face, then that may be somewhat troublesome to the patient. If we are suspecting the frontomaxillary sinusitis, and if we need to start with a Tikshna leba, then it is better to prepare the leba and apply in a gauze piece and apply that gauze piece over that scalp, this maxillary sinus area. That will be better. So it will not going to create more irritation to the skin. So usually if we are advising the Gaura Sarshaba or the Tikshna Lebanam, like the Nagaradi, usually we are giving the Nagaradi Lebanam or in Jambira Swarsam or Gaura Sarshaba Lebanam, the Tikshna medicines, then it is better to apply over a gauze piece and it should be applied over the frontomaxillary area. I think no need to go for the whole area. It is better to localize the Samprapti. This localize the treatment where the Samprapti is going on, that is the frontomaxillary area, and it is better to avoid the direct application. Instead, we can apply over the gauze piece and then apply over the required area.
Thank you, sir. Now, the next question is from Dr. Jasla. Sir, after Kuttana, how long should we keep the Tikshna leba?
Tikshna leba, usually we are after Kuttana, we are applying the Tikshna leba and sending the patient and advising her not to, means in the treatment also Acharya mentioned not to means don't take bath after this, immediately after the procedure. So we are advising the patient to keep the leba over there. So within 2 or 3 days, it will be completely as it's on, it will be removed. So no need to remove the leba forcefully. Let the leba to be removed as its own, or as naturally it will be removed from that scalp area. So in some cases, if the patient having more problem with the Tikshna leba or severe burning sensation, in that condition we are giving the Indralupta mashi, mainly the Indralupta mashi with the Malatyadi Thailam, or usually the Indralupta mashi or the Hastidanta mashi should be applied over the Dhatrura Patraswarasa. That means Tikshna Lebana is the medicine of choice in that condition. So I think after the Kuttana, the bleed, it will start bleeding. And if you are doing the Lebana, then that medicine will be directly going to the hair roots. And if you are trying to remove that forcefully, then it will be irritating, or it will be very much harmful to the scalp skin or scalp hairs, which is starts appearing. So I think it is better not to tell the patient to forcefully remove that leba. It will be removed as its own.
Thank you so much, sir. The next question is from Dr. Kimaya. So can you tell more about Lashana Rasayana?
Actually, if needed, I think you can get that article in Google. That's a Lashana Rasayana. I think we have started with the 0.5 ml and increased up to 5 ml per day. I think 0.5 ml increasing dose. I think usually it was completed in 10 days. So Lashana Rasayana means it is when we will enter the patient's room, that much smell was there. That means nobody can approach in that room if they are not um, familiar or having some irritation with the Lashana. That much smell. That means the patient will also start smelling the Lashana. So we have started the Lashana Rasayana with the 0.5 ml. Then it is increased to 5 ml. So that gradually the patient the dose was increased, and we have given the maximum dose of 5 ml. So in that condition, it is very essential to take the indication and contraindication of the Lashana Rasayana. That means if the patient is having severe acidity or any gastric irritation, then we know that the Lashana is a Pitta Prakopa medicine. It will go to irritate the Pitta Rakta. So if the patient is having some gastric ulcer or gastric gastritis, then it will be very much problematic to that patient. So here in that condition, we have done the Snehabana, and last we have thought about the Lashana Rasayana. Why we have thought about the Lashana Rasayana? Because the patient was not comfortable to the Tarpana. So that was the striking point in that case. There the means actually in Tarpana, Nayane Tamadi Stabde Ruksha Shushka Bihadi Vada Vittadure Jihmi, like that, all the Tarpana indication in with Syandamanda Anyadovada Vada Pariya, all that condition, that means the Tarpana is indicated. But the patient is not accepting the Tarpana. So we have stopped and Lashana Rasayana. So Lashana Rasayana, it is the patient is having a neuralgic pain. The neuralgic pain means there is no doubt that it is of Vada Pradhana. And the neuralgic pain and the Vada Pradhana and the Vada Agriya Aushadha is the Lashana. And if the Kapha Avarana is there, then the Lashana becomes very perfect medicine. So we have started with the 0.5 ml, and the maximum dose of 5 ml was administered to the patient.
Thank you, sir. There are a few more questions. Shall we continue, sir?
Yes.
Thank you, sir. So the next question is from Dr. Aisha. Sir, can you explain the management of hemifacial spasm?
Actually, hemifacial spasm, that means it's a facial pain syndrome. That means it is usually coming over there. That is a hemifacial spasm, mainly due to, I think, the trigeminal nerve will be involved in that condition. I think we can manage it same line of management of the neuralgic diseases that means we have discussed. So the hemifacial spasm means the condition which is mentioned in Ayurveda is the Shirakamba is mentioned. Shirakamba is that means the patient having total movement of the Shira. That is usually it is happening in the Parkinson's like disease. So in the totally happening over the head. But in hemifacial spasm means that area is only having some twitching. So the twitching of the eyelids, the spasm of the hemifacial spasm of the cheeks or trigeminal neuralgic pain, all these are managed in the same line of approach. Here the Vada should be given as a prime important dosha, and mainly after the means the main Snehavana with the Rasana Dashamula Kritam will be very effective. Means in the condition to serve the Snehavana with the Rasana Dashamula Kritam and Nasyam with the Mahamasha Thailam will be very effective in that condition, because there is no other dosha will be accompanying the Vada. Here the Kevala Vadaga Samprapti will be there. So we can start the Nasya with the Mahamasha Thailam, and then the Annalevana is the best medicine. No doubt that Annalevana is the best medicine, and we can try for the Rektamoksha if the patient is not at all responding from the Karnamula. Karnamula Rektamoksha is also that we can try in that condition, but the ultimate treatment or the main focal treatment that we are selecting is the Annalevana.
Thank you, sir. The next question is from Dr. Rekha. Sir, can you explain about Neerirakam, the improper use of oil in head or bath causes it, and how to manage that condition?
So the Neerirakam or improper application of the head or exposure to the cold or anything that we are happening in Ayurvedic point of view, we can say it is the Abhishanta. So we have mentioned that Sarva Urdhva Jatrugata Srodasam Syandanat Syanda. That is the Syanda, that is Abhishanta Samprapti will be considered. Then Paishilyad Gaurava Dravyam Rutva Rasavahasira Santapte Gauravam Esyad Abhishanti Adadari. So that is the condition where the Rasavahas Rodadushti having taking place and the having the Samprapti of Abhishanta. Abhishanta means Rasa, Rekta, Dhadus are going to be vitiated. So the line of management is nothing but it is a Rukshana, no doubt, because this Abhishanta Samprapti need a Rukshana treatment. As we have discussed in the today's presentation, the best treatment is Talam. Go for the Rukshana Talam. So the Rukshana Talam means the Rasna Jambira Talam is that common medicine that we are using here, or the Shirastodadi Guliga or the Marmavat which should be crushed and it should be applied with the Jambira Sarasana. So the Rasna Jambira Talam is a best method to immediately cure the Neerirakam, or the Neerirakam means it is the Abhishanta Samprapti. So and just review the medicine that the patient is going used, and that may be a medicine which is not proper to that patient, that we have discussed. If the patient is having a sinusitis, if a patient is having a sinusitis with hair fall, then what happens? The patient will take a Shida, means the Vata, the hair fall means it is the Vata, Pitta, Kopa, and mainly for the promotion of the hair growth, the Shida Virya is required. So the patient will start applying a Shida oil on the head in the condition of sinusitis. Then definitely it will start the Samprapti of Abhishanta, and the patient will start sneezing, then neck pain and heaviness of the head like that. So it is an Abhishanta Samprapti. So go for and tell the patient to stop that medicine and go for a Rukshana Talam. It is the best method.
Thank you, sir. The next question is from Dr. Kimaya. Sir, can you explain some procedures useful in facial palsy?
Facial palsy procedures means actually the facial palsy Ardide Navanam, Murthni Thailam, Srotrakshi Tarpanam. It is the classical line of management is mentioned. So Ardide Navanam, Nasyam is the best line of approach. Murthni Thailam, that is Abhyanga Sega Bijuari Vasti, and the Srotra Akshi Tarpanam. That means the eyes and Karna Puranam. So while we will discuss the line of management, means we are approaching the facial nerve, means in the eyes, Tarpana. Why the Tarpana is indicated in the facial palsy? Because the orbicularis oculi muscle, which is supplied by the facial nerve. So that muscle will be also involved in a condition of the facial palsy. So Tarpana is indicated, and as we know, that means the facial nerve is passing through the fallopian canal, which is present in the middle ear. So the facial nerve is having a very close relation with the middle ear, and the main Samprapti starts there. That means the stylomastoid foramen, the facial nerve passes through from the cranium to the facial area through the stylomastoid foramen. So it having a great relation with the ear. And as we know, the facial palsy or the Ardhidam can be happen with the Kevala Vadaga or Vada Kavaja. Both Samprapti that can be happened in the Ardhita Ardhita Samprapti. So if we are doubtful, then it is better to start with the Rukshana. So the Rukshana means the common cause of facial palsy is the edema of the nerve in the fallopian canal or in the bony canal, that is the stylomastoid foramen. That means it is coming out through the stylomastoid foramen. So that bony area, the patient is having exposure to the cold, and then the nerve will start edematous and it will be compressed and it will suddenly going to the facial palsy. So in that condition, the best method to start with the Rukshana to address the Shofa. So the best method is the Talam. No doubt the best method in Ardhita, most of the conditions we are starting with the Rukshana Talam, and afterwards the patient will start improving. Means if the Ardhita means it is having a natural cause of remission also, and if we will start the Rukshana treatment, then the patient will start improving. And if the patient starts improving, but the orbicularis oculi muscles and the cheek muscles will be responding in a later stage. In that condition, we can start with the Tarpanam and Karnapuranam along with the Shirodhara, and ultimately the Shirovasti is the most effective treatment in the facial palsy. And while before starting all these Tarpana, Karnapurana and Shirodhara, all these are the Shamana treatment. So before that, we are addressing or Kafadosha with Nasya. That is Kshiradhuma Nasya will be given. That means Kshiradhuma as a Purva Karma of the Nasya, and Nasya is usually doing with the Dhanandaram Avarti, and afterwards the Tarpana, Shirodhara and Karnapurana will be advised.
Thank you, sir. The next question is from Dr. Babita. Sir, the ideal treatment for repeated ingrown eyelashes.
Repeated intern eyelashes, is it?
Ingrown. Yeah, yes.
Ingrown means that is the condition of trichiasis. So trichiasis means it is a condition of inward turning of eyelashes, and if that is along with the eyelid, then it is entropion. In trichiasis, it is mentioned as the Pakshma Kopa in Ayurveda, and it is an Yapi Vyadhi. The ultimate means Santam Shekena Adhikam Pakshma Hrutva Tasyashim Dahe. That is the treatment advised in Ayurveda. So if the main problem is that it is going to irritate the cornea, and Susruta mentioned that Vada Adaba Anala Dveshi. That means the patient is not able to tolerate the wind or the light. That means the corneal irritation, that means cornea, if it is irritated by the cilia, then minute ulcers will happen in the cornea, and the patient is not able to tolerate the light or wind. In that condition, the first line of approach is to remove the irritated cilia and do the Agni Karma in that condition. I think no other means usually in Ayurveda after this the Pushpakas is Anjanam. Anjana is the best line of management mentioned in that condition, and otherwise the patient should be managed means with the epilation as well as the local application of Anjana.
Thank you, sir. So with that, we've come to the last question of the session. Sir, for how long should Talam be kept?
Usually that we have discussed maximum of 45 minutes that we are advising. Means as per the purpose. Means if for an insomnia, we are giving Talam of Shida Virya and it is addressing the Vata Pitta. So we can, if that condition is very apt, then that will be doing a Shiro Murtha Taila effect. That can be considered as a minor as a Talam. So in that condition, we can keep the Talam for long time. And in conditions like the Abhishanda or Neerirakam, I think it is no need to keep for a long time. It is better to give the Talam for 20 minutes. So it will last from 20 minutes to 45 minutes. And usually we are giving the thalam for morning and evening. And if the patient is having only sleeplessness, then it is better to give the thalam during the evening time. And if patient is having a severe stress, then it is better to give the thalam for morning and evening. So according to the prakriti and according to the purpose, the thalam duration will range from 20 minutes to 45 minutes.
Thank you so much, sir. So we'll wind up the session for today. It was a very stimulating discussion, sir. Like always, very, after the class, we get lots of questions and you patiently explain each and every one. Even if there's any repetition, you are always willing to solve each doubt of the participants, and that's why we love to have you here, sir. And so thank you for encouraging us to think more and to help us serve the patients in a very good manner. Thank you so much, sir. Please do continue to support Team CAME and have a very good night. Thank you to all the participants. We'll see you again tomorrow for the final session. Thank you, sir.
Thank you.